Hi, you're watching this video, and if you are, hopefully you're planning on coming in for a cardiopulmonary CLIC session in the next couple of days. So this is something that is brand new, so I'm trying to do something a little new as well with how I'm introducing you to it and walk you through the next little bit and what you expect to see from a curriculum standpoint. So let's talk briefly about the rest of the playlist before you jump into it. So the next part of the playlist is this. You essentially see how to use an ultrasound with probes and knobs, and specifically what probe does what, the basic physics behind it, the philosophical underpinnings of why we use point-of-care ultrasound at all, and then a walkthrough of cardiac anatomy and the windows, and cardiac pathology, and then lung anatomy and lung pathology. That should make you relatively functional with regards to how to do point-of-care ultrasound. I fully realize that this is a fair amount of content that I'm giving you. Unfortunately, with the way the curriculum is currently and the number of hours that are available, I can't really do this any quick. I can't split this up any better, but hopefully that will improve for future years. Now, there is something new that's happening. So when you guys come in for your hands-on sessions, you're going to again be split up into 3 groups. But those 3 groups are going to be a little bit different than what you've had before. Let's assume that you walk into Group A first, and in Group A you're coming in to do, into Room A you're coming in to do sim practice. So you're coming in and seeing a standardized patient like you have before. You're practicing a basic echocardiogram on that patient to try to get some pictures and see what's going on. Then you're going to go ahead and do some lung ultrasound with the high frequency and the low frequency probe and try to get some pictures and just understand the basics. It will be a small group session. There will be some interdisciplinary experiences with potentially some nurse practitioner students there as well. And once you've done all of this hands-on practice, what you're going to be moving on to is we will then in the next hour move you over to the high fidelity simulator room. And we'll come back to that in a minute. And then the third part will be for room C. After that hour, you'll move over and we'll do a medical decision-making talk. So we'll talk about each of those one by one. So let's start by discussing our high fidelity sim. So Cooper ended up investing in buying some very nice high fidelity simulators. So essentially, a high fidelity simulator gives you a mannequin that is armless and legless, but can give you essentially the ability to place an ultrasound probe on the mannequin and get a very nice ultrasound image that your instructor can change to whatever pathology they desire. And there is the option of turning on anatomy view as well, so you can sort of see the anatomy in real time. So the way this will work in practice is you'll come in and you'll go ahead and you'll practice, and let's say you're doing echocardiography. You might do something like this, for example, where you see Dr. Seamus, one of my residents, has the ultrasound probe in her hand. She's got it on the simulator, and then here you can see on the computer screen she's moving the probe around and getting all of these different views. And you're able to see both the anatomy view here and the ultrasound view here. So this is really exciting because it gives us the ability to demonstrate pathology to you and give you guys a chance to actually go through and diagnose pathology on simulators. This should end up being a very important part of your education. Now, what I'm planning on doing, and again open to feedback on this, is starting you off by just giving you the ultrasound image as though it was real life for the first part of the case. And then once you think you've made the diagnosis, what we will probably do is have your next colleague come over, or have you potentially come over and just redo the images real quick in the view which gives you anatomy as well. Okay. So for the third part of the hour, you'll be going over and doing medical decision making. And medical decision making is a classroom case. And a classroom case sounds super duper boring. But I'm going to give you a brief preview of what that classroom case will be like, and hopefully it'll be a little more exciting. So what I'm going to be doing is presenting cases to you, giving you real life or pseudo-real life examples of cases we have seen amongst the faculty, and helping you think through the diagnoses, what the potentials are, how you're going to work them up, and what the utility of each test is. So for example, if let's say you have a patient who presents with chest pain, I would tell you that they're a 60-year-old guy who presents clutching the side of their chest in agony, bent over, really uncomfortable. I would give you a set of vital signs, a heart rate of 110, a blood pressure of 90/50, an O2 sat of 92% on 4 liters, and a respiratory rate of 30. I'd give you an examination, here's what the heart and lungs sound like, here's what the belly sounds like and feels like, here's how they examine, answer any other questions you have. And then I'd ask you to start making a little differential diagnosis. You'd come up with a differential based on that. And then we get some tests. We talk through an EKG potentially and what that would look like. We talk through a chest x-ray and what that shows you or doesn't show you. And then we talk about differential diagnoses. So, for example, for this gentleman with chest pain, let's say we came up with these 3 differentials. And then we would have to talk about something else specifically that might bring back some traumatic memories. We'd have to talk about how good your tests are that you chose, specifically your likelihood ratios and what that changes when you look at pre- and post-test probabilities. And the reason we're doing this is because with an evidence-based fashion, we really should be thinking through how good is the test I'm doing, is it going to change anything I do, and what's the change going to create? And we'll talk through that as well. Okay. This was just a very brief introduction as to what the next few hours or potentially days will bring for you depending on when you're scheduled. If you have questions, please send them my way. This is my email address as always. Thanks for listening.